has, yep, hopefully the presentation will come up. I'm ready when people are. I made Daria, as I said, I sent Daria until very recently the wrong slides. So I'm hoping that these are the new slides because there's a very bad mistake on the last one. But so this is what I want to talk about, is that public sector workers on the front line and risking their lives for workers and for the public. And the question is, what should governments be doing in return? There is a commitment between you when you contract your labour over to an employer, and certainly in public services to the government, an expectation and an understanding that we put ourselves on the line for the public. But actually, that means that there should be a bond of trust between us, and governments need to reflect what we say. So if we could move on to the next slide. So I just want to talk a little bit about the last one, please. That went, thank you. Went on to the last, just a little bit of what's happened to us. The UK now, United Kingdom, now has the most deaths in Europe, and we are now the only second behind the United States of having the most deaths in any country. And this was because we were our strange British spirit, but we are very slow to go into lockdown. We were 2 weeks maybe slower than many other countries, and this meant that the actual virus got a hold far quicker than it should have done. And what it means is that now we are plateauing, and many other countries are on the way down and easing themselves out of lockdown. The problem is that our government seems to want to get out of lockdown at the same rate of other countries, yet we are 2 weeks behind. And what that means is there is a real increased potential of risks and threats to our workforce who are currently in there, and I'll explain that in a minute. Now, in the main area of deaths now are no longer in our health service, as has been for many other ones. They're now in our care homes, where older people particularly will move quickly out of hospitals to make space in the hospitals for other patients who had coronavirus, and this is now spread in our in our care homes. So there's something about planning between our different systems of central government planning and then working in the home care system. So there remains continuing risk to workers. There are contradictions in the new proposals from our government to move out of lockdown. So the public is told to keep the distance. We're allowed now to do more exercise in the park as from today. But actually, and some of our workers have been sent back told they can go back into work. But what we haven't done is we haven't changed the public transport system. So our public transport system is still running as though we have not got out of lockdown to protect the public service workers. One of our main areas of deaths, a surprising high area, has been bus drivers who have been particularly targeted. But what we now have is we have all these workers who have now been told they have to return to work are now crowded onto trains and buses and plans. So again, there is a problem of dialogue in our system between central and local government and planning, which we just don't think is good enough. And again, our testing capacity is also not good. Our testing capacity was much lower than many other countries. You know, we look at South Korea with envy. It was very poor. It's still very poor. It's mainly targeted on health service workers. But as I said, things have moved on, and we have problems with home care workers who can't get access to protective equipment. So there again, our systems are running behind the reality, and our government doesn't seem to be able to catch up with that. I won't go too much now onto the details of the engagement social partners, because Mads and colleagues have already spoken very well about the need to engage social partners. But what we see again in our country is that central government is more of a dictator, and dictates too strong a word. It tells people more what it wants to do and doesn't engage us properly in the debate. We have much better dialogue with local government. We have much better chance to influence them. Not everywhere. We have our disputes, we have our problems, but local government, apart from central government, apart from our health service, where we have a functioning and a proper European style social partnership forum, we don't really have that dialogue with the employers properly, and that means that we get into conflict. And one of the reasons I was late on today was that I'm dealing with a real big problem we now have about reopening schools, which I'll touch on in a moment. So on to the next slide. So these 4 points I wanted to talk about lessons we've learned, and the lessons that we've learned and still aren't learning is that communications and science are vital. So what I see at the moment is In schools, for instance, the problem I'm dealing with today, again, the government have said that it's safe for, it's not safe for the public to be allowed to socially distance. However, in certain areas, it is safe and people don't need protective equipment, particularly schools. So our government is moving today to a situation of moving in and getting getting primary schools, some pupils in primary schools back into them, the very young one, and they tell us this is safe. Unfortunately, they have not provided us with the science that shows this is safe. We pick up we hear from, say, Denmark, where the schools have gone, we hear from the Netherlands, but we've never been provided with the information that gives us the confidence to say to our members and our workers, this is good science, we can believe and we can trust that. So only now, having told us on Monday that we will be moving out from schools, only this Friday are we now being invited to meet some of the experts. But we know from some of the experts, the things the experts have said is some of them contradict each other. So we don't have that trust. So getting the science out quickly, simple, easy message is really key to moving on from lockdown. The flexibility of local government has been really vital during this whole process, and we've played our part in this. We have helped workers redeploy, we have moved people across, but what we've insisted to do first thing is, start with volunteers. Let's not transfer. And actually, within most cases, the volunteers have worked. It's been really helpful. People have redeployed. But again, where there have been problems, where there have been mistakes, there have been serious mistakes. So I have a case, not too long ago, a terrible case where a worker was seen as a street cleaner, was moved on to work on the refuse lorries. But they assumed that because he knew how to sweep the streets, he would know how to work the lorries. Unfortunately, he didn't. He got caught up and has now been very badly injured in one of these refuse lorries. So you can see how the importance of training, the importance of not jumping to conclusions can really undermine it. But in general, the flexibility of local government has been something we've learned out of this. But what we've also seen as a result of that is that local government have been hampered and undermined, particularly by funding. We have gone through a period, as many people around the world have, of austerity. It's been really problematic, and government services have been run down, but also the planning services that would get us out of this have been run down. The services that would allow us to do have been really problematic. So I'll move on to my last point, and the question, the final point is, are workers sacrificed? And I'll give you an example of where we still see potentially workers sacrificed. And that's in places like, I've touched on refuse workers, and refuse workers are still being crowded, 3 people to a cab with no personal protective equipment. Now, this has been a particular issue with some of the larger the larger outsource companies, and those larger outsource companies don't have the flexibility, say, like local government. Local government have been able to utilize other drivers who are currently being redeployed to drive people behind in vans, and those people can be socially distanced. But the private companies don't have that flexibility. They run on very narrow profits, and so they haven't issued those. So that for me is an example there. So I'll land there. I have plenty more examples, but I hope that gives you a flavor of some of the challenges we are facing as we come out of lockdown.